joins us. Hey, Linord.
Hello, Jimiaki.
So cancer is taking quite a toll on Zambians this
Yes,
time.
definitely, and we'll look at it shortly. But first, a new health bill in Kenya would allow people to access the HIV/AIDS and sexually transmitted disease records of their partners. All other health information will remain confidential. The bill is expected to become law within months. It also proposes that no Kenyan should be denied emergency medical care for lack of money. Health experts say cancer is becoming a growing burden in Africa, and Zambia is making efforts to address the issue. Zambia's health officials say there is an increase in cancer cases in the country. They say 3% of the 13 million population died from the disease in 2010. The most common cases are cervical, prostate, and breast cancer. Lusaka resident John Lungu has one theory as to the cause.
You will see an increase in the number of takeaways and restaurants that are selling junky foods. And I'll be very honest with you, and in my own opinion, junky foods are not good for our health because they are a major contributing factor towards cancer.
The World Health Organization says cancer is the leading cause of death worldwide. Studies have linked foods high in sugar, trans fats, and simple carbs to the development of cancer tumors. Officials at the National Food and Nutrition Commission of Zambia say bad eating habits are indeed partly to blame for the rise of cancer in the country.
We are seeing now a continuous trend that a lot of people are actually rushing to eating outside homes, and we have these fast foods coming in. And then one of the problems what this is going to cause is what we call Zambia is likely to go into a situation whereby we have more people who are actually overeating. And then when you start overeating, it's because of the high foods that we're eating, and that would lead to what we call overnutrition.
Experts in the country say that the modern lifestyle is contributing to rising cases of the disease. They say factors such as urban living, busy schedules, and eating in restaurants is exposing people to cancer-causing ingredients. Zambia's first specialized cancer treatment and radiotherapy center, CDH, was opened in 2007. Treatment at the CDH, the only facility of its kind in the country, is free, but patients outside Lusaka have to spend money to get to it. Beatrice Malombo is one of them.
I have encountered heavy financial challenges towards seeking treatment for my cancer. This is the 4th year I have had the disease. Today, I'm still hopeful and waiting to see if the radiation therapy I have been receiving will help end my cancer.
Doctors at the hospital are trying to raise awareness on the role of diet in the prevention and treatment of cancer. Professor Grossbeck Param is a cancer specialist.
Every cell in the human body is programmed to die after a certain period of time. But if the DNA is damaged and damaged in a certain way, the cell never dies. It becomes immortal. And that is one of the major characteristics of a cancer cell. It has immortality. It never dies. The only way it dies is when it destroys the body in which it is captured. So we need to put foods in our bodies that will bind these free radicals.
The CDH was set up at a cost of $10 million and receives technical support, equipment, and training from the International Atomic Energy Agency. But even with the new facility, the availability of qualified staff and financial resources still remains a challenge for Zambia's cancer control program. And that's all for today, Dimiaki.
Well, thank you so much, Linord Moudou joins us every Tuesday and Thursday here on In Focus with the latest health news.